Rizwana Ramzanali lives in London, Ontario. She has worked with the Kidney Foundation for 14 years. Rizwana is a kidney patient currently on dialysis. The diagnosis of kidney disease can be traumatic. She knew nothing about it until it happened to her. Rizwana is passionate about supporting patients through their kidney journeys in her role as programs coordinator. She believes there is still life after this dreadful diagnosis. We just have to find our way around it. In her spare time, she enjoys walking, reading, cooking, and volunteering. Ladies and gentlemen, please join me in giving a hearty Walnut Foundation welcome to Rizwana Ramzanali.
Okay, go ahead. Did you want me to bring in the other speaker? Let me know when you want to bring her in.
Yes. Okay.
Okay.
Thank you, Vernon, for that introduction. And I have one of our star volunteers with me. Her name is Lynn, and she's going to share her personal journey with us before I get into what the Kidney Foundation does.
Should I bring her in now?
Yes, please.
Okay. Okay. She's spotlighted. Go ahead. Hello, Lynn. Welcome.
Thank you. Thank you, Rizwana. And I also want to thank the staff of the Kidney Foundation for the support that you've provided me through my kidney journey. And I hope I don't get emotional. Anyway, I also want to thank this organization, the Walnut Foundation, for the work that you're doing. Knowledge is important in managing our health, and this is what you're providing. It's reassuring to know that this organization, an organization like this, is helping men in our lives to value their health and to take care. My father is now 95. He had prostate cancer at the age of 67, and it was caught early, and it was treated and it never returned. My brother-in-law, though, was not as fortunate. He died at 58 with a more aggressive form of prostate cancer. He battled it for about 8 years. So it's good to know that there's support out there for men learning more about their health. With my kidney journey, it started about 8 years ago. I did not experience symptoms as was noted by the doctor previously. My doctor noticed though some abnormalities in my blood work and sent me for further testing. Based on the result of the test, I was referred to the nephrologist who ordered a biopsy. And at that time I was diagnosed with chronic kidney disease. I had been hypertensive for 20 years, and although well managed, my kidneys were damaged from high blood pressure. We've got cardiovascular, we have a history of cardiovascular disease in our family. My mom died of that. And so we're always very conscious. Even at 33, I found out about my high blood pressure by accident. My mom took me, let me take your blood pressure. And she took it, and sure enough, I was hypertensive. So I've been on medication since then. For the first 5 years, the disease progressed slowly. But beginning about 3 years ago, it started to advance more quickly. With the support of the multi-care clinic at the University Health Network, I managed my health as best as I could. And what that means is what the dietitian was talking about, and as well as the nurse from the multi-care clinic, is that I watched my blood pressure, I diet and exercise, and I maintained my 6-3 and then monthly checkup with the team at UHN. The goal was to put off dialysis as long as I could. In the year before dialysis, I started to notice symptoms. I was tired. I remember evenings in the middle of making dinner after working all day that I had to sit down because there was a crushing tiredness that just hit me from nowhere. Talking about running out of steam, I struggled with nausea. So it was interesting hearing the dietitian talk where those were all symptoms that I experienced. I unconsciously adjusted my eating patterns to ensure that I didn't get nauseous. That's when I started eating like a bird. My sister used to tease me whenever we go out for a meal. I always needed to do a take-home container because I couldn't finish. I also had trouble sleeping. During this time though, some good things happened. I reconnected and fell in love and married an old school friend of mine. He came into my life at just the right time. I'm very grateful that he's here to support me in my kidney journey. He embraced the role of care support and helped me to ease some of my anxiety. My Christian faith also helped me through this period. I started dialysis 2 years after celebrating our first year anniversary. So I guess, you know, when you take your vows, the better for richer for poor, better for worse, whatever the case is, and in sickness and health, that came into play very often. I tease him about that all the time. On the day I started dialysis, I walked into the home hemodialysis unit, and it hit me that this would be my new life. The Toronto General Hospital would be my second home, which it is. And home hemodialysis units will be my second family. And I looked around the room and saw a mixture of 6 people. They were young, old, men, women of various ethnic groups. I was now one of them. These were my brothers and sisters in the kidney journey. I chose to do home hemodialysis, which means that I have to train to do my treatments at home. And that includes doing my blood work and ordering supplies. Initially, the training was overwhelming, but I kept thinking that I'm not a nurse, I'm not gonna manage this, but I did. With the support of the home hemodialysis team, I pushed forward and my confidence grew. When I was first diagnosed with chronic kidney disease, I did not know I didn't know that I was gonna be on dialysis. What I didn't envision is how it would change my life. There were physical changes I had to get used to, the fatigue, the tiredness, the foggy brain, as my body adjusted to the treatments. I had a catheter in my chest and later a fistula in my arm. I had to adjust to my clothing that I wore. The good thing is that I began dialysis during COVID, so I wasn't going out much, so I didn't know about the clothing. It's now that I'm discovering, oh, I can't wear that dress because it's sleeveless, right? There were lifestyle changes as well. The loss of time spent doing dialysis. I established new routines at home to accommodate dialysis. I do it at home at night. I do nocturnal dialysis, and I do it 5 days a week, 8 hours at night. At this time, I reached out to the Kidney Foundation to join one of the peer groups, the peer support group. I needed to hear from others who were living with kidney disease and to learn how they manage their lives. I met others who were living their lives for years with kidney disease. And contrary to what I believe, I think it was the multi-care nurse who mentioned that I believe that, oh, I'm only going to live 5 years, that's it, I'm gone. But when I joined the support group, to hear people who were living successfully with on dialysis or with transplant, that was very encouraging to me. The Kidney Foundation also, I attended a lot of the online programs, which just helped my knowledge, helped me understanding more about the disease and knowing that there was support there. The knowledge and support from the foundation put me in a better frame of mind to envision more for my life and having kidney disease. I must say that being on dialysis compared to how I was before, I do feel better. You know, there are times that I'm not 100%, but there are days that I might feel fatigued, but there are days that it's great and I can go about my life and do all of the things that I usually do. I am an employment coach career-wise, and I continue to do that work on a volunteer basis. I've re-engaged in church activities and reassuming a few responsibilities that I help. My husband and I are hosts for international students, so we bring people into our homes and we enjoy showing them the city and interacting with them. Here I say the quality of my life has been better since being on dialysis. Yes, physically, as I said before, I'm not 100%, but the key for me is realizing that I can choose to engage in the activities at a pace that is best for me. I choose to take care of my physical, which is still really important, by carefully following the dialysis prescription, exercise, and I eat well. So thank you to the dietitian. It's provided some good information. I care for my mental health by listening to my body and seeking help when needed. And I also focus on my spiritual health because it helps to keep me hopeful, optimistic about my future possibilities. So thank you.
Thank you, Lynn.
Thank you.
See, this is why I said she's one of our star volunteers. So I'm going to now delve into how the Kidney Foundation fits into supporting kidney patients. And before I do that, I'm just going to tell you, share very briefly about myself. Dr. Natu and Paulette talked a little bit about transplantation. I did receive, my kidneys failed because of poorly managed diabetes and high blood pressure. And I was on dialysis for 7 years before I received a kidney and pancreas transplant here in London, Ontario. Very successful. I unfortunately and sadly lost my kidney after 16 years. Thankfully, my pancreas continues to work well. When I say I had a kidney and pancreas transplant, it meant that I no longer needed dialysis, nor did I need insulin shots. I had been an insulin-dependent diabetic since the age of 9. So thankfully, I still haven't had to take, my pancreas is functioning fine, touch wood, and I'm taking really good care of it. And I do dialyze 3 times a week here in London. I chose to do the in-center hemodialysis because I have 2 jobs. I have a full-time job with the Kidney Foundation, and I also have a part-time job, which I will be leaving for very shortly. And I want that independence, and I don't want to have to worry about setup. And I like to go into the dialysis unit, meet other patients, and not feel that isolation that a lot of kidney patients feel when they're diagnosed. So that is the treatment that I have opted to go for. I am going to play a small, I do have a PowerPoint presentation because I'd like to share how the Kidney Foundation supports kidney patients. One thing I do want to let you know is we do not share any medical advice. We will immediately refer you to your renal professional or your dietitian. So give me just a moment and I'm going to share my screen. Is that visible to everyone?
Yes, it is.
Thank you. So the Kidney Foundation, supporting you to understand your kidney health. So what is the Kidney Foundation of Canada? Our vision, the Kidney Foundation of Canada is committed to achieving excellent kidney health, optimal quality of life, and hopefully one day a cure for kidney disease. I hope it's in my time. Our mission is to fund and stimulate innovative research for better treatments and a cure, providing education and support to prevent kidney disease in those that are at risk, and empower those with kidney disease to optimize their health status. We really, really focus on this. Kidney disease is not the end of life. Advocating for improved access to high quality healthcare, in increasing public awareness and commitment to advancing kidney health and organ donation. So we really, really need individuals like you to talk about, help raise awareness. A few years ago, the Kidney Foundation created this tool. The link is at the bottom right-hand corner, and it is www.kidney.ca/risk. You click on this and it'll ask you 10 simple questions. If you find that you're answering yes to more questions than no, we recommend you print off that report and take it to your family doctor and ask if you can get tested, have your creatinine level tested, and your eGFR, because it may be showing signs that you have kidney disease. So what does the Kidney Foundation do to support patients that come to us for support? We have a peer support program, and it is designed to provide services to people who need a listening ear, support, and information. Our volunteers, like Lynn, are those attentive, caring ears. They're trained by the Kidney Foundation. Lynn here is a facilitator for some of our support groups, And she also provides one-on-one, she also does one-on-one with patients who are not ready to yet join a support group. So really, really appreciate volunteers like her. The types of Kidney Connect support the Kidney Foundation provides. I will go into each of these one by one. The one-on-one support, which I just talked about, is when patients come to us and just want to have a very confidential and private conversation. They have questions that they're not ready to ask in a group. So we will connect them with one of our trained volunteers who has gone through a journey similar to the person that is looking for that information. We have a toll-free number that we will give to our volunteer. He or she will connect with this individual and they can have a conversation. It can be a one-time conversation. It can be a conversation that can go on for many weeks. We let the two individuals decide between themselves how they want to proceed with the conversation. And here are images of some of our trained volunteers. And then we have our peer support groups. Because of COVID, our support groups are meeting virtually across the province. And we do have, these are our support groups. Now, if you happen to live in a city that doesn't have, have a support group, it doesn't mean you cannot join another support group. We have participants that join from all over, and we allow that because it takes time for these participants to find a group that they feel is right for them. They fit right in. They enjoy how the facilitators run the group. They have connected with the participants, and so we've left it open. In the last year or two, we have also introduced a support group for caregivers. Caregivers are just as important as the person that's living the kidney journey. We have lots and lots of participants who come to us living with reduced kidney function. And we too have two support groups that meet twice a month. We have a pediatric a caregiver support group, a transplant connect. And in December, we introduced our young adults. Unfortunately, we are seeing younger and younger people being diagnosed with kidney disease. This support group has taken off. When I talk about our support groups, we get participants, from 7 to 19 to 25 join a group. If any of you has visited a dialysis unit or a kidney clinic, you may see this information. This is our support group calendar, and it gets updated on a monthly basis. Our support groups meet monthly, and as I mentioned, we have 14 support groups. We also provide online support. And this is done through our website, where somebody will reach out to our national office in Montreal. And depending on where that individual lives, that information will be sent over to the correct chapter. And then, staff like myself will hop in and support that, reach out to that individual. We will connect by email or by phone. And we will then try provide them for the support that they're looking for. In clinic or hospital support, because of COVID, we were not allowed to visit hospitals, but they're now opening up their doors to us. So we do go in from time to time and talk to patients. A patient that's been newly diagnosed and needs to learn about the different types of modalities, which is also the types of different treatments available. And we, either one of us will go in and we'll take a volunteer, or, who is on a type of dialysis, and they can have a one-on-one chat there. The lived experience we find is really, really beneficial. There's also the Transplant Connect, as was mentioned by Dr. Natu and Paulette. Transplant is a cure, it's not a treatment. Very, very successful. We actually have one of our peer support participants who has had his kidney for 43 years. He received his kidney in the 70s, and he's so proud to share his journey. So, you know, there is hope there with the transplantation. We highly, highly encourage everyone to register to become a donor. And that can be done at beadonor.ca, or you can consider becoming a living donor. Information and referral, and these usually come to us through the social workers. We work very, very closely with the renal programs, and this information and referral comes to us through the social worker, you know, who will want to refer a patient who is looking for more information in general, and like you know, like the other like the online support, we will connect with this individual and find the best way to support them. The Kidney Foundation also provides short-term financial assistance. You know, as you know, people living with kidney disease, renal failure, or a transplant sometimes, well, face a cost around medication, you know, the right foods to eat. So the Kidney Foundation supports them with the financial assistance. And the ways that we do it is through, we provide funding for transportation to help patients get to and from dialysis, you know, or for an appointment, emergency living, equipment for home use. We provide blood pressure monitors. And we also sometimes, from time to time, provide weighing scales for patients who opt to do the peritoneal dialysis and have to weigh themselves before they start their treatment to be able to take off the right amount of fluid. We will provide a weighing scale to them. Accommodation. London Health Sciences Centre, which is the hospital that I receive my care at, oversees patients from a huge portion of southwestern Ontario. Patients have to sometimes drive into London from Owen Sound. It is a 2.5-hour drive. You know, so then we will provide, they have to sometimes come in and train for either a home hemo treatment or PD. And they do require accommodation. So we do fund them for a portion of their accommodation. Medication as well. Not all medication is covered by the Trillium drug program or benefits that some of us receive from our workplace. And so the Kidney Foundation provides funding for that as well. And all these requests are sent to us from the social worker. We have a form that is filled out, and if they are if they are able to get the support, we do support them. Now, the Kidney Foundation does have the Chinese Renal Association chapter, and these are some of the volunteers. And we also have a staff in our office who is Chinese. So she's able to support Chinese patients, you know, in Cantonese or Mandarin. Very, very beneficial as we're seeing a growth of kidney disease in the Chinese population. Oops, sorry. And then we also have the African Caribbean Kidney Association, of which Paulette is a member. Thank you, Paulette. And we are looking to recruit more volunteers for this association. So if any of you is interested, please don't hesitate to reach out to the Kidney Foundation. Ken has my contact, so please feel free to ask for my email address, and we would love to connect with you.
Okay.
So here's a little bit about ACA. We call it ACA, and it is again a volunteer chapter aimed to help individuals of the African and Caribbean origin understand and manage their risk for kidney disease. So I'm so thankful to the Walnut Foundation for inviting us today to present. ACA strives to be a conduit within the African Caribbean community to provide supportive programs to individuals living with or at risk of kidney disease who are in need, and to improve strategies to raise public awareness of risk factors and prevention of complications from kidney disease. And that's what we've discussed today. So great presentations. Supporting patient empowerment. We always encourage our patients to feel empowered. And the way we provide it is by helping them understand the treatment options and how to live with chronic kidney disease. Knowledge and confidence navigating the healthcare system. So we tell them, about how to, if they have a diet question, where to look for, the Kidney Foundation has a kidney community kitchen, which we refer our patients to. And if it is something that we are not able to support them with, then we will refer them to their dietitian. Ability to provide self-care and manage overall well-being. Open a positive communication with healthcare professionals. Don't ever be afraid to ask questions. No question is stupid or silly. You need to educate yourself on your condition so you can live a better life. And then also building confidence with peers and care teams and friends. Don't be hesitant to let your friends know that you've been diagnosed with kidney disease. You want to get together with them and you may be on a special diet. Don't be embarrassed or hesitant to let them know about your diet. There's nothing wrong. It's not something you've done wrong. It's just the hand of fate that's been dealt to you. So, acceptance is so important, and that is how we provide support, by helping our patients accept what is happening to them and how to live well with their prognosis. The Kidney Foundation also provides manuals. These manuals are free. So if somebody that who has been diagnosed with living, with compromised kidney function reaches out to us, we do offer to send them the Living with Reduced Kidney Function manual. And if there's somebody that is on dialysis, we will send them with a manual with living with the kidney failure. As I said, these are free. And if any of you is interested in any of these, please let us know. We will be happy to mail you a copy of these. We also have our brochures, fact sheets, and more. We do go out and present at health fairs. We love going out to universities and presenting there. And this is what one of our setup will look like. If you want to subscribe to our Kidney Living magazine, please let me know, and I would be happy to help you do that. It is a magazine that we publish 3 times a year. It has, stories from our patients, what's happening with the Kidney Foundation, update on the most research that is happening across the country. And these are some of our educational events. If you look at the bottom right-hand corner, this is what one of our peer support sessions will look like. This picture was actually taken last March. March is Kidney Health Month, and we have a campaign that it's the 6 degree of kidney disease campaign. And all the participants that joined us, we asked them to hold up 6 fingers in support of the cause. So that's where that picture was taken. These are some of our volunteers who go out and present, or they have gotten together for a seminar or a symposium. We do have renal. There were some amazing questions asked, and Tamika, great presentation. on a renal diet. The Kidney Foundation, as I mentioned earlier, does have a kidney community kitchen. This has been designed by renal dietitians across the province, and it's updated on a regular basis. You can sign up for it, and if you choose a certain recipe, it'll tell you how much potassium is in a recipe, how much phosphorus, how much sodium the recipe will have. I depend on it quite often. When I had to go back on dialysis, I love tacos, I love beans, and I thought that that would be a restriction for me. But our Kidney Community Kitchen has really great recipes on foods where you can actually use beans. There's also a nice taco recipe, a fish taco recipe. So I'm still able to enjoy a taco, even though I'm on dialysis. So it's a really great resource. As mentioned by Dr. Natu and others, exercise is so important. We do encourage our renal patients to exercise, and we do have a program that runs out of Brampton. It is a free program. You have to sign up for it, and Monica Deluski has helped patients design a specific program for patients if they have specific needs. The link or the website to register for this the Active Living program is in the left-hand corner. And please, again, don't hesitate to reach out to me if it's a program you'd be interested in joining. Now, the Kidney Foundation holds webinars on a regular basis. As I mentioned, March is Kidney Health Month, and World Kidney Day falls on March 9th. So on March 8th and March 9th, we are coming together with other provinces, and we're putting together a symposium. It is going to be a 2-day symposium. The first one will run from 12:30 in the afternoon until the evening, and the next one will run during the morning. We're going to talk about patients traveling while on dialysis. We're going to talk about medication. We're going to have a cooking demo. We're going to share, have individual patients share their personal journeys. And then there's going to be a networking session. You don't have to be a kidney patient to join the webinar. If you want to feel educated about kidney disease, you're more than welcome to join us. The website will be going live next week. So if you're interested, please feel free to get my email address from Ken, and I would be more than happy to send you the link for to the symposium. And here's a little more about our virtual symposium that is on March 8th and March 9th. As I mentioned, we'll be talking about traveling, medication, youth, family, and children. And then we'll also be talking about self-advocacy, CKD wellness. There'll be updates on research. There'll be the Kidney Community Kitchen. We'll have a cooking demo, like I said, dealing with symptoms, and we'll have networking sessions where participants will come from across the country and to chat and learn more about how other patients are coping with their diagnosis. So connect today. Our peer support volunteers like Lynn assist many people each year and help those who find access to services and provide encouragement and learn more about how to live with kidney disease. To learn more about these services, please don't hesitate to email us. The email address is in the bottom. This email will go to our programs administrator, and she will then send the information over to us. The Kidney Foundation's Ontario branch has 5 staff, of which 4 are kidney patients. So we really understand those, those that reach out to us for support. This is the end of my presentation. If you have any questions, please don't hesitate to answer. I will do my best to answer them. If you have any questions for Lynn, she's also available to answer them for you.
Yeah, please put your questions in the chat for either Lynn or Rizwani, and we'll get them to respond. I don't see any specific questions. You guys did such an amazing job of presenting.
Ken, I had one while you're looking.
Go ahead.
So is there an explanation for why so many younger people seem to be impacted by kidney disease? Just seems like of late we're hearing about more younger men, seems like. I'm not sure why. Any explanation for that?
From what we see, it's the lifestyle, eating habits. It's a lot of the younger generation depend highly on, on takeouts. They're not very cautious with their diets, and they're not always able to be cautious with their diets. They're either in school or they're working. So it's to do with their lifestyle as well. Yeah.
Thank you.
Great. So there don't seem to be any questions, which is a sign that you guys did such an amazing job. So Rizwani and Lynn, I'd like to thank you very much. Survivor stories are always great because they talk about lived experiences, and it actually goes farther than the actual clinicians and dietitians and stuff like that. So we really, really want to thank you. It was amazing.